Hello.
Go ahead.
Hello, can you hear me?
Yes.
All right. As all of us are aware, we are in unprecedented times, and we are at war, and extraordinary circumstances cannot be treated in an ordinary manner. We are happy to have our panelists, our speakers today. We have Dr. David J. with us. Day is the founder and managing director of Africa Economics and one of East Africa's leading and most influential independent economists. We have Commissioner Lawrence Mute, member of the African Commission on Human and People's Rights and Special Rapporteur on Freedom of Expression and Access to Information in Africa. And then we have Dana Musinda Luezo, a leading African feminist and gender and development expert and current director of policy and communications at Womankind Worldwide. We also have Professor Atia Wallis, director of research and enterprise, University of Nairobi, and a professor of fiscal law and policy. We also have Walinda McKenna, who's a researcher and a fourth-year law student at the University of Nairobi, who's joining us as a speaker today for today's session. Also, we have Dr. Richard Ayer, Director, Science and Technology Park, University of Nairobi, where he leads in innovation and incubation space, where academics, innovators, and the business community interact to create wealth. This session for today, we'll also have, we are delighted to have all of us across different spaces joining us for this particular session. And we'll be delighted to have your comments and feedback around this space. On March 23, the IMF Managing Director noted that the outlook for global growth for 2020 is negative, a recession at least as bad as during the global financial crisis or worse. She further observed that emerging markets and low-income countries face significant challenges. They are badly affected by outward capital flows, and domestic activity will be severely impacted as countries respond to the epidemic. The OECD in this March estimates the decline in level of output as such that it is equivalent to a decline in annual GDP growth of up to 2 percentage points for each month that strict containment measures continue to happen. And I would want to refer this, the situation we are in, to look at the 2008 post-election violence growth. After the post-election crisis, the Kenya Institute for Public Research and Policy, KIPLA, and the government's working group produced a 4.5% growth rate under its optimistic scenario, while its pessimistic scenario produced a slight negative GDP growth. However, according to the World Bank, the reality is that 2008 growth was 1%. We'll invite our speakers to take us through 7 minutes of discussion on fiscal implications of national and global emergencies in their various areas of interest in light of COVID-19. And we'll start with Dr. D, who will take us through his well-written and well-presented arguments across this specific topic. Dr. David B, karibu sana.
Thank you very much. Hopefully this technology works for us because we are all learning.
We hope it does.
It's quite new, this sort of thing. I know it's been around for a while, but I'm not a technology person, so I sort of now have been being forced to get into this. I'm glad to see all of you. I'm glad to see Lawrence after a very long time. Lawrence, how are you? And of course, my good friend Richard, who I can't see yet. Oh, there he is. Yeah, hi, Richard. Very good. Now, let me say something. I think The IMF and what you've just said, and the IFIs are really behind the curve. They have been behind all along. I observed almost 2 weeks ago that people need to start thinking about wartime economic management. And then I saw the IMF saying the same thing yesterday or the day before. Why were they so behind the curve? And why did I actually talk about wartime economic management? Immediately that this took off. It's very simple. Really, it's not prophecy, it's not profound. It's very simple economics. Given what we are facing, markets will not work. Yeah, markets are not gonna work. That was fairly obvious from the word go. Why? Because the economy depends on the market economy in particular, depends on social interaction and mobility.
Okay.
Yeah, that's what keeps the economy going. Yeah, social interaction and mobility. Now, to stop this pandemic, you need to stop those two things. Yeah, you need to stop slow down social interaction very, very drastically, and literally stop mobility. The first thing that we has now stopped is aviation. Global aviation has stopped. So once global aviation stopped, the tourism industry stopped, our horticulture export industry stopped. Yeah. So the only thing which stops the economy, not slows it down, but stops the economy, large chunks of the economy happening, and kills mobility and social interaction is war. And during war, you don't rely on markets. Because what happens is that it has affected the supply side, so there is less production going on. It cannot be produced because people cannot go to work. You cannot produce manufactured goods by working online, and you cannot distribute them by work online. So it stops that. If you stop that, large segments, and then on the consumption side, people also are not consuming. They are sort of people go into survival mode. So once people go into survival mode and you cannot produce, your economy deflates. That was fairly obvious from day one. So when I heard people saying that they are going to use economic stimulus, they are going to do all manner of things, I said, these people really, they haven't done their basic economic analysis of asking, what are we facing? What is the nature of this shock? It's a shock of the character of war. That's its character. And in a way, it's a war against a pathogen. So that leads us to then the people are realizing it leads us to realize that the dichotomy that people are saying that is the priority public health, intervention, emergency is the priority, economic is the priority. Those dichotomies are false dichotomies. Yeah, because it's a multidimensional thing. And what happens on the economic side has a feedback loop into your public health response. Because the public health dimension, the medical emergency, stops your economy from functioning. If your economy stops functioning, you may not have the resources for the public health response. So I think people are dichotomizing something so during that's why my point was from the outset. We need to think about wartime economic management. And when you think about that, what you want to ask yourself is, which supply lines must you keep open and how will you keep them open? Because the rest of the economy will have to shut down. So you want to think about food, you want to think about energy, and transport and vital transportation. You want to think about medical commodities fundamentally and keeping those things going. And we don't know for how long. Okay. People have not gone into that mode yet. They are talking about growth. So I'm like, we need to stop talking about growth. It's irrelevant. Growth will stop. Okay? Growth will stop. Now, we have some huge unknowns. We don't know. We are flying blind on the epidemiology side. And I sort of been pilloried a lot by people calling themselves scientists that I am challenging science. And I say, if you find experts who don't want questions, they probably don't have answers because they are not answering our questions. They're telling, shut up, don't question science. Now, we don't know how this thing is spreading. For instance, we don't know whether we don't have many confirmed cases because they don't actually exist or because we are not testing. We have no idea. And I ask myself, I mean, our crude death rate is about 5 to 6 people per thousand, which works out to about 700 deaths a day. Okay, normally. If we had 2 or 3 more because of COVID, would we know? Would we know if 2 or 3 more? Now, 2 or 3 deaths more per day, 2 or 3 more deaths per day, by now is something like 40,000 infections if we use the global parameters. We wouldn't know. I don't know. If we had an additional, well, if we had 50,000 cases and we use the global parameters, we would be talking about maybe 400 or 500 critically ill people. If we had 300-400 more critically ill people with pneumonia in our hospitals than normal, would we know? I don't know. I have no clue. You help people tell us. So to summarize, I think a lot of the trade-offs and dichotomies we are talking about, short-term, medium-term, we don't know. We need to accept what we do not know. Is it, when we say short term, is it 2 months or is it 6 months? Is it a year? None of those questions I see answers. So for me, certainly in terms of the economy, the disruption of the economy is now independent of the disease, of the pandemic itself, because it is now being driven by psychosocial factors and political and social psycho factors, and also moral-ethical. The fact that even if we don't have many cases, we cannot afford, we have to overreact. And if we have to overreact, based on the precautionary principle, it follows that that has a huge disruptive effect on the economy. Okay, so whether it's 2 months, 3 months, the economy is going to take a hit, and that's going to feed back into your public health response. So the sooner we go into this wartime mode management thinking, coordinating resources, as whatever we haven't been at that ourselves, but other people have been, I think the better. But as long as we are talking growth, how can we minimize this? This economy, I can, my own sense, and I'd say this even before this crisis began, we were already tottering on the edge of collapse. It was a matter of what the trigger would be, whether we would survive until the next election or whether there would be a shock trigger. Now, we have not just had a small shock trigger, we have had a huge shock trigger. And the maximum I think this economy can survive without going into meltdown is just another 2 months, maximum.
Okay.
It cannot go beyond that.
Thank you very much, Dr. Much appreciated for those for the insights. We're going to invite Dr. Commissioner Mute to take us through the insights around this pandemic, and also from a human rights perspective, having well written and widely written about human rights and what COVID-19 means. For us. Karibu, Commissioner Mute.
Okay, I hope my audio is unmuted. I hope you can hear me. So
yes, I can hear you.
Good morning to everybody. Let me begin by saying that, speaking about technology actually, that you'll hear someone speaking in the background from time to time because I can't stop him from speaking. He's my screen reader. So I hope you'll still be able to hear me over the screen reader. Now,
Absolutely.
I have consciously chosen to focus on one aspect of this pandemic, because usually what happens is that in the course of addressing the bigger picture, some of the more specific issues that I think are of particular relevance can get lost. So in the discussions of the bigger picture. So in fact, at the end of my remarks, I'll mention a couple of broader human rights issues, but I want to concentrate on the question of disability specifically and its place in this whole discussion around what are the best interventions in respect of this COVID-19 pandemic, particularly from a Kenyan perspective. Now, I think we need to keep in mind a number of factors. First, I think any national responses, the national responses that need to happen, must appreciate that when you speak about disability, when you speak about people with disabilities, essentially you're speaking about people who involve broad and varied interactions. So here you're speaking about a person and the way a person interacts with their impairment and their environment, and then social factors. So to give an example, when you have a person whose legs are impaired, that person has a mobility disability when the environmental factors which are around him, such as rough terrain or, last week, such as, obstacles like the Likoni crossing or the Likoni channel, when they interact then again with social factors such as stigma and prejudice. And unfortunately, therefore, what that means is that depending on how we respond to the COVID-19 situation, then people perhaps who are not particularly disabled become even more disabled. So it's important that we keep that in mind. And then when we speak about preventive or curative interventions, we need again to recognize that disabilities are quite diverse. So usually we'll be speaking about the obvious ones, the sensory, the physical, but you would also be speaking about intellectual disabilities, you'll be speaking about psychosocial disabilities. And then again, even within those, there are lots of subcategories. Now, I think the relevant questions then which we need to keep in mind are at two levels. One, you're speaking about people with disabilities who, on account of disability, face greater risks of infection or death in respect of the COVID-19 situation. But then again, you will be speaking about people with disabilities who, while not at greater risk, face danger deriving, due to systemic discrimination and also arising barriers. So then the questions become, what should we be doing? What should policymakers, policy implementers be doing in response to some of these issues? And I think you're looking at two things. You're looking at process issues, but also substantive issues. Now, when you look at substantive interventions, some of the things which I have heard clearly would be quite problematic. So you're thinking about unmediated blanket lockdowns and the curfews, and you ask yourself, will those sorts of interventions will not leave behind, most people with disabilities who must earn each day subsistence. The discussion around tax breaks or tax waivers, for employers or even for employees. Again, the question becomes, would those impact the people with disabilities who dwell on the peripheries of the informal sector. You look at social protection initiatives for persons with disabilities. Now, I know the instinct right now will be to take away money from existing initiatives. So you're thinking about, things like cash transfer programs for persons with severe disabilities, which are already existing. You're thinking about funds such as the fund for persons with albinism. And you're asking yourself, are they going to take away those sorts of funds apparently so that then they redirect them to things like fighting the COVID-19 disease? And then clearly again you have problems with that. The final issue which I highlight as far as substance is concerned, when you look at the WHO established guidelines, again you ask yourself, what is their relevance vis-a-vis people with disabilities? And the sorts of questions which arise: what does social distancing mean today for a blind person seeking sighted assistance to cross Tomboya Street? What exactly is it, or is it not? What are the logistics and finance dynamics for quarantining or isolating a person with a disability who has high support needs? These are what in our laws are called people with severe disabilities. These are people who require caregivers, for example. And you look at closed institutions like Madare Mental Hospital, where you have lots of people with psychosocial disabilities. Again, the question becomes, what are we doing with that? And finally, what does it mean for a learner with a disability? Now we're speaking about schooling being transferred onto online platforms, online education platforms, again, which tend to be inaccessible to them. Now, in terms of process issues, I think the point there would be that COVID-19 messaging must employ formats which are accessible to persons with different types of disabilities. And here you're thinking about things like sign language interpretation, you're thinking about accessible websites, and you're thinking about legacy media, particularly radio. So this becomes extremely important. The question of communicating in plain language, which then would be understood by people with different disabilities, including learning disabilities and intellectual disabilities. So the final point I wish to make, assuming my main time must be almost over, so on this last point of communication, I wish to finish by remarking on a matter which I think is extremely important to these interventions which are happening today: the importance of the right to access to information. Now, this is extremely critical during times such as these ones, during times of epidemics, during times of pandemics. Information must be accurate, must be accessible, it must be timely. And in the course of my work as Special Rapporteur on Freedom of Expression and Access to Information in Africa, I have had occasion to welcome, as an example, Nigeria's extraordinary success in fighting the West Africa Ebola outbreak of 2014. And this, in part, was anchored on the proactive measures which the government of Nigeria took to publicize information on the disease. So then it would be ultimately self-defeating if the government of Kenya failed to proactively disclose information which is pertinent to COVID-19, and if indeed the government's knee-jerk reaction was or involved content takedowns and things like censorship. I think really the bottom line is, you look at our limitations clause in the Constitution, Article 24, you look at our African Commission on Human Rights, African Commission on Human and People's Rights Declaration on Freedom of Expression, access to information at Principle 9, which really sets out the context within which any limitations would need to be dealt with. You're saying that any limitation of right must be prescribed by law. So you ask yourself, what has been happening the last couple of weeks? Is it limitations must serve a legitimate aim? The limitation must be a necessary and proportionate means of achieving the stated aim in a democratic society. So I think my final thought, therefore, is clearly, you might almost think, not directly engaging on fiscal in the classic sense issues, but actually extremely important and extremely important perspective on how then this country ensures that, for example, we would not take away whatever social protection measures we already put in place simply because we are reacting to this pandemic, but rather that we build on them. Thank you very much.
Thank you. Thank you very much, Commissioner. And you've raised substantive issues, the question around what we're doing for people living with disabilities. And like Dr. Day had mentioned, for how long, we don't know, what is going to happen, and we have to accept it could be short term, could be long term. Professor Atias, I want to invite you to take us through the next 7 minutes of this conversation. Karibu.
Thank you very much. So I need to share my PowerPoint. So I'm just going to try and do that now. If I have a difficulty, Valerie is going to help me. Can you see my screen?
It's not yet up. It's coming up.
Can you see my PowerPoint? Okay. Let me know when it's up.
Yes, it's up. It's up now.
Okay, super. So,
would you
thank you very
please
much.
Please take it to a presentation mode?
Yes, it was. It was on presentation mode. Let me try that again.
Yeah, it's okay. It's okay now.
Now?
Yes.
All right. So I'm very interested in what both David and Lauren said, because these are conversations we've been having well on the side. The whole concept of how to react is very important, but I think we also have to think about how to react from an African perspective, and how an African reaction might be different from how others might react in a similar situation in the global north. And I love this. This is an African proverb, and it says it's a crooked wood that shows the best sculpture. And we know we're in a system where they don't run well. We have a lot of challenges going on right now. And our systems are not in place. But now is the time for leadership. And now is the time when people need to make very careful and carefully crafted decisions so that we move in the right direction. And I want to start, what should our system look like? And then what should it look like in an emergency? And fiscal legitimacy requires a system to be transparent, accountable, responsible, effective and efficient, and then fair and just. And Lawrence reminds me about the need to keep fairness and justice very squarely in the center of things that we are continuing to make at a national, continental, and global level. So I'm actually going to jump off where Lauren stopped, which is the issue of access to information. And I think one of the key challenges that is going to face African governments is the fact that we don't have good access to information generally. But in the case of a pandemic, when in an emergency people are predominantly sitting at home, we hope, how to access information becomes a completely online process. And since last year, my team and I have been looking at budgetary information across the continent. And so this is the first update of information we have. There are only about 18 African countries that even have laws on freedom of information. But then that is not good enough. African governments agreed about 5 or 6 years ago that they were going to spend a minimum of 50% of their GDP on health. So now 2 things come to focus. Healthcare, normal system, was supposed to hit 15% of GDP. These are the only African countries whose data is actually publicly available. So out of the 54, 55 African countries, we only have these. So already countries and people in the country first system of information in place, and don't know how much is being spent properly on their healthcare systems. And that's in the normal scenario. What happens then when we go into emergencies? So we went into all Ministry of Finance, Treasury, or equivalent websites across the continent, see what was actually available. And you see something very interesting. There's almost this middle band through the continent where they don't even have Ministry of Finance websites. So even when we are talking about accessing information, there is a whole swath of countries that have zero access to any kind of financial information. And then, of course, on the outer edge, you see countries in West Africa don't have information, and down in South Africa, Southern Africa, there are a couple as well. So now that we know what is or is not available, we went beyond the website of Ministry of Treasury and Finance to now start looking at publicly, generally available data. What you start to see is that there is some available data publicly. So orange says there's a limited information, and says there's some budget data, but again, not necessarily comprehensive. Again, you can see huge swath of countries, absolutely nothing even in the public domain. So we were looking at content and quality. The kind of information that we were looking at was citizens' budgets, budget speeches, actual budget data online. But now we tried to look for emergency funds, and we noticed a problem. So we saw the only country that had some kind of continent was South Africa, but that wasn't even in their national databases. That was in an IMF report. So unless you're deliberately trawling online to find this kind of information, you're clearly not going to find it in a member of the public. But when we decided to widen the research, so is Africa the outlier? Are other countries actually communicating with their populations on emergency funds and what is available? And we discovered that there are only 7 or 8 countries actually have some kind of information. And even then are these very broad parameters, which is normal. David, this is a normal formulary way of doing things. But it adds to a lack of clarity. And so there is this Maasai proverb, which I really love. And he who is unable to dance says the yard is stony. Well, our yard is stony and we can't dance. And we need to jump pretty high if we're going to figure out how to get through this, because the land is rocky and government needs to open up the space. And the reason I'm talking about this kind of data set is because the government has rolled out a requirement for people to self-isolate, but they've done it without actually reflecting on whether or not people listen to them, whether or not people can afford to listen to them. We don't have a good relationship when it comes to security forces in the country. And already we've seen a young child passing away, stray bullet or a targeted bullet. We're not even sure about that. Now, here is a situation where if we look at Kenya, if I come back into just Kenya rather than the whole continent, where you have a population that has been odds to security forces. What makes government think, without changing something in the way they are communicating with the people will even listen to them? And I think this is like a PR nightmare because they seem unable to break through that communication bubble and get it across to people on the ground. Essential is information, and I think information on how the emergency fund is going to run. We've seen IMF committing 60 million plus. We've seen other donors committing. What I would like to see, I would like to see a barometer online on the websites of every single African government and every single institution that is providing emergency funding. We see the barometer, we see what is needed, and of course the needs and requirements are going to be changing sometimes on a daily basis. But what actually needs to be updated daily. Now, for me, this is beyond finance and the fisc. It is not just about how much money we need. We are also going to go through incredible shortages. And what David said really resonated. We need to secure the value chain that's going to keep us going in times of emergency, which is almost like a situation that we are for. And food security are critical. But also, how are we treating frontline medical care workers? So there is the element of financial protection, but there is also the element of non-financial services that are services in kind sometimes. I know doctors with their Hippocratic oath can be called into action at any point in time. I'm wondering why they haven't been called into action yet to give voluntary service. So there is service and then there is money. And we need to make sure these two are working very tightly together. Thank you very much.
Thank you very much, Prof. You've mentioned some great ideas, and especially fiscal legitimacy and the question of transparency, accountability, responsibility, and fairness. I've picked up on those particular ones, and especially with regards to the contingency funds, which you mentioned, data is unavailable. So we know, like in Kenya, the contingency fund, according to the regulations, have a permanent capital of 10 billion, but we have got no idea of any data existing on the spending of that. Thank you very much for that. I will call Dina to take us through the next session. I know, she's worked a lot, with feminist movements, with women across Africa, and her current work at Womankind, is amazing. Please take us through, and of course, was to be cognizant to what the Chief Justice mentioned yesterday, that within the last few weeks, cases of gender-based violence, for example, have increased within this pandemic. What does this exactly mean, in the light of the space that we are in now?
Thank you very much, James. As you have said, my intervention is going to focus on the gender dynamic of the COVID-19 epidemic. And I would like to start from the point of, first of all, recognizing the current economic model that we have, which is in itself is a failed system. And to acknowledge that actually COVID-19 crisis is feeding on that failed system and other multiple crises that we have been facing, but refusing to acknowledge them and to work on them. And I think it is important to acknowledge that so that we know why we are where we are and why countries are finding it very difficult to respond effectively to this current crisis. We know that the current economic model is characterized by huge levels of inequalities between countries, but also between people. So between countries, especially in the global north and in the global south, but also between people, between men and women. But even within that category of men and women, we also know that there are people that are even most marginalized and excluded, and those are going to be facing this crisis differently, and indeed they will be more affected by the current crisis. We also have an economic model that does not value some work and values another work, but by the forced division of production and reproduction. So anything that falls under reproduction is not as valued as that falls under production. And here I'm talking about really work around unpaid and domestic work, which is disproportionately done by women. We know that women perform majority of this work. The global statistics stand at 76% of all unpaid and domestic work performed by women, again because of the social and gender relations as determined by the society. And I think you can see how this is already playing out in the current crisis. Also because of the global inequalities between North and South, we know that African countries and other countries in the global South are losing a lot of resources through illicit financial flows, tax abuse, debt servicing, including in this same country that we are in Kenya, and fair trade policies. And so even as we ask ourselves whether we have enough resources to actually respond effectively to this epidemic, we need to ask ourselves, where do these resources come from if already we have lost so much resources through these global inequalities? The conservative figure, as many of you know, is 50% billion US dollars lost annually from Africa through these financial flows alone. And so if these revenues are lost, and these are the revenues that we would have drawn from to actually use in this current situation, but also in the situation of strengthening the health system. We have heard from Atia how the health sector, especially the public health sector, is underfunded, leave alone that we don't have that information. But what we know is that actually we don't have a strong health system. We also have a health system that is hugely privatized. So the role of the state in providing public services is extremely weak, but also something that, the current economic model again discourages the role of the state to provide and protect human rights, but also provide essential services such as the health, even though we know that in the international human rights standards, access to health services is actually a human rights. And so if that is the context, then I think it can tell us why we are struggling right now. And if I talk to the issues, specifically the gender dynamics of COVID-19, so the first one that I've talked about is unpaid and domestic work. And this is essentially done by women, mainly because of social norms that I've talked about. And so we are in the current situation where some of the measures around social distancing is to have children stay at home and be schooled at home. But again, because of the existing gender social norms, this work actually, we know that it is being done by women. So these are women that either have also paid work going on or underpaid work going on, or even if they don't have this paid work, to mean that the work that they're going to do now with children not going to school and everyone being at home at this time, it means that the burden of unpaid and domestic work is going to increase, which means that some women are going to either choose to abandon their paid work or they will be laid off because they are not able to keep up with what is expected. And we don't have means in place to actually contribute and support this unpaid and domestic work. As we are. Not that we don't have means, but also I'm not sure whether we have the political will. But also, as I said, we have an economic system that already doesn't acknowledge and recognize and value this work, and that's a problem. The other issue I want to talk about is issues gender-based violence that the moderator talked about. Gender-based violence or violence against women and girls. Already we know that gender-based violence or violence against women is an epidemic in itself, even though it is not acknowledged as such, because we know that 1 in 3 women face physical or psychological violence in their lifetime. We also know that actually a lot of violence happens at home and happens with intimate partner or someone that you know in the household. And so by telling everyone that we need to stay at home all the time, we're also telling women that they have to stay in a place that is not safe for them, or to stay in a place that they have to be staying with their abusers 24 hours. Because I mean, that's what the statistics are telling us. Because also according to the United Nations Office on Drugs and Crime, in Africa alone, we see 68% femicide being committed by intimate partners. And so if that is what we know in terms of statistics, we also know that then homes are not safe for women. But also statistics coming from China, in an area where COVID-19 was experienced towards the end of last and beginning of this year, is that domestic violence increased actually by 3 times during the COVID-19 epidemic. And of course, that is like an indication that that is what is going to be happening in other countries that are being affected with COVID-19. One, because of what we are seeing coming from China, but also what we already know in terms of data and statistics and evidence around violence against women.
Thank you very much, Dina.
Okay.
As we wind up, you please wind up in a minute, please.
Yeah, so I mean, as there are different gender dynamics, including in terms of socioeconomic issues, in terms of food supply, in terms of essential services that are being put on hold. So, for example, the maternal health services. We know that all these services are not being prioritized in times of coronavirus, but yet these services actually are also emergency services. And if we ignore these services, it means that we are going to see increased rates of maternal death, child mortality, and we are going to see cases of femicide increasing. And therefore, my call is really to policymakers to really think about also other emergency services that needs to actually still continue to be provided even during the coronavirus pandemic, but also ensuring that we do ensure that we take a multi-stakeholder approach. We need to consult and engage women's rights organizations and women and finding out how this epidemic is specifically affecting them, and that requires also collecting data that is gender and sex disaggregated, and ensuring that we get to also draw on the expertise and experiences of women's rights organizations and movements that actually have a good reach with their communities. I think someone talked about lack of trust of police and other government institutions, but we know that these organizations and movements have already established trust and are connected to their constituencies in communities, and they can actually pass on information, mobilize, and they can not just only support during the response, but also for the recovery in terms of long-term impact. Thank you very much.
Thank you very much, Dina. You've mentioned some critical issues around the increasing levels of global inequality, and also, the inequalities also between men and women, the question around unpaid care work, gender-based violence, and socioeconomic issues that needs to be addressed around the supply chain. I want to invite Makena to take us through the next session. Makena is a researcher and a fourth-year law student at the University of Nairobi, and we are glad to hear from you. Makena, karibu.
Thank you so much. Okay, so my perspective is from a humanitarian perspective. Can you hear me clearly?
Yes, we can hear you.
Okay, so from a humanitarian law perspective, we have noted that there are increasing situations and circumstances where we are faced with police brutality. And so when we look at that, we'll notice that there are some places where there have been lockdowns. For example, in Kenya, we have noted there are cases of a boy who was shot recently. In Zimbabwe and Rwanda, 2 people have also been shot. And when you look at this, it's not like police brutality has been a case that has come up recently. It's just that it's in the spotlight more now that we are facing the pandemic. And really, when you look at the fiscal implications of police brutality, you realize that citizens will be burdened for the ones who lose their breadwinners in the families, and for the wounded citizens, you'll notice that they'll have to incur new costs for health services, which already are very poor in African countries. And we can also see fear among the citizens because of the beatings and the shootings that have been happening recently. And when you look at this, you realize that the situation and the relationship between the citizens and the government is increasingly becoming, it has tension and it is suffering. And when we try to look at how best to come up with solutions for solving the pandemic and how we can come together as a country, we realize that the fact that there is fear and there is tension between the relationship between the citizens and the state, it becomes more difficult to face this challenge as a nation. And so when we look at that, we also notice that there are homeless people in Kenya and in other states as well. And we have to ask ourselves, where will these people go? There is a lockdown. Who is supporting them? Where do we get the shelter? And what are the policies in place that the government is putting so that we can be able to also assist our fellow citizens? And in countries like France and Greece, we have noticed that instead of police brutality, what is being done is that people are being fined if they are found in public areas or outside when there is a state of emergency. And so in this period, we can try to use fines instead of beating up people people and killing them. Additionally, we can try to use the rules of engagement more when talking about the military and the police. In rules of engagement during the peace times, you'll notice that they are trained on how to behave towards civilians, how to accordingly act without really infringing on the human rights and the human dignity of the civilians. Additionally, we can see that some of the states that have put policies that come around to state lockdown, we have noticed that some of them may use policies that go against the human rights, and they may use some of these policies to give power to the government instead of the people, and we should also look at that in a humanitarian perspective. And I think when we look at these issues in this time, we can also find better solutions and at least come together as one so that we can find a solution that fits everyone without having some people feeling left out or some people suffering because of issues of brutality and lack of food, and that's leading to starvation and whatnot. So when we look at the humanitarian perspective as ensuring that the government also keeps to its original responsibilities of catering for the safety of the citizens in the areas that they are, we'll also be able to calmly and positively face the challenge of the pandemic without incurring or burdening more people with health costs. Yeah, I think that's it for today.
Thank you very much, Makena. Much appreciated for that updates around that. And one of the interesting things that came out is that the increasing tension between citizens and state. And I want at some point quote Dr. Day. He mentioned that state is not to be tolerated. And when to get to that, bit of tension, we all understand that, within this space, the question around the breadwinners, losing lives in this space, and especially this time, becomes very disheartening for citizens. I also want to invite Dr. Richard Aya, Director, Science and Technology, Park University of Nairobi, to take us through the next 7 minutes on how COVID-19 has affected his work, and dealing with academics and innovators and the business community, and what that means for us, going forward in times of this pandemic. Karibu sana, Daktari. Daktari, are you there? Hello?
Hello.
Yes, I can hear you.
You can hear me now? Yeah, okay. I think you're the one who muted the thing. I was saying that I had put on a shirt similar to what David D wears so that I can look the part in this webinar. And I was struggling to upload a PowerPoint presentation. I don't think I'll be able to manage it. So I'll just talk a little bit about from a health systems perspective, and then I think I'll pick it up later on. Now, so two aspects. I think we have really focused a lot in terms of what the ministry has been presenting in terms of mortality. That's, we have so many people who have contracted the disease, and then around the world there's been this issue about the death rates. And one of the curious things is that the death rate so far in Africa, in sub-Saharan Africa, has been very low compared to other WHO regions. And there are a number of reasons given for that. But it's a curious thing as to whether it is just that we're not testing, or there's something peculiar about how the virus is here. And I'm just echoing what David had talked about. We don't really have very good data. And I think even what's been presented about this thing about freedom of information, there's an issue, a feeling that perhaps there's a lot more data that should have been or could be presented but is not being presented. So it's very difficult to figure out where we are and where we're going. And I think a lot of it just reflects the weaknesses of our health system, that a lot of some data is collected. When you're within the system, you know, a lot of people doubt the veracity of the data. But I think that's one thing that we have to recognize, that one of the reasons why no data is presented is just the fact that it is not collected well. It's a weakness of the system, and it's a very big weakness of the system. So when we think about the health system, I think we have to divide it into two. One is we have to talk about the clinical side, and then we have to talk about the public health side. And by public, I don't mean government, I mean the side that's supposed to do prevention. And that is extremely weak. And we've had a situation where in the last few years, the emphasis has been on the hospitals and the higher levels. And I think when now we come to what COVID has exposed is, number one, particularly the private sector, but almost all the large hospitals do not report their data into the national system. So your private hospitals don't release their data into the national system. And this is whether it is Kenyatta or Aga Khan and so on. So we don't know what they do. What we do know is that they consume half of all health expenditure. So they consume a lot of money, and they don't really show much in return, particularly from a public health perspective. So there's that one thing about the death rate so far being low. And this is curious because we know that lower respiratory tract infections, of which COVID is one of them, because we talk about pneumonia, the mortality rate is highest in sub-Saharan Africa and Southeast Asia. So you would expect that if this thing hits in a big way, then we should be affected even more. And this is a worrying thing, even more than what has happened from China into Europe and so on. And the number of socioeconomic factors that affect, and some of them is malnutrition, others are lack of access of cooking fuel, levels of vaccination, sanitation, and the big one for me are these vulnerable populations. So we have a HIV prevalence rate. About a third of people with HIV in Kenya are not on antiretrovirals. We have a diabetes rate, and this is in Kibera alone from a study, of about 5%. A lot of them do not know that they have diabetes. Hypertension is about almost 20%. A lot of them do not know that they have the disease. So COVID is going to expose these diseases. So what I wanted to really emphasize is that for a lot of us, and this was the sort of the echo about vulnerable populations, the fear it is the people who are super healthy in the context of our environment who are fearing COVID. And they're the wrong people to fear COVID. So the way in which the health system has reacted, and almost naturally so, because people within the health system recognize they don't have much in terms of resources, they have turned away those people with the chronic conditions. So clinics were shut down. A hospital like Moi Referral said no visitors to inpatient. Yet these are the people who very often take care of the patients because there are very few nurses. So the people who are most vulnerable from a disease perspective are now sitting at home in lockdown, probably going to start running out of drugs. Certainly they're not getting care as we focus on COVID. So within a very short period of time, these people are going to start coming back in crisis. And then we're going to be in a real problem, because these people are the ones who, they're vulnerable to the disease, they're vulnerable to the weakness in terms of the health system, and they're the ones who are also now going to create a further problem because of our very weak COVID detection strategies. then it means that we're probably going to have a lot of health workers being affected. And by that, I don't necessarily mean in terms of them falling ill. It doesn't take too much in terms of just exposure or for health workers to have to go into 14-day quarantine. So imagine a health facility having to shut down for 14 days because the entire group has to go into quarantine for 14 days. So what happens to the people who need care? So that to me is the sort of short-term problem we're facing. By short-term, I mean in the next 3 months. Now, I've got some data from KDHIS, the KHIS, and it shows that pneumonia has been, over the last 3 years, pneumonia cases have been increasing by quite a factor. Now, this is just the general trend. Now, further to that, there is quite some difference between counties. So based on what the minister has been reporting, where the cases are coming, it's surprising that, so the average number of cases of lower respiratory tract illnesses is about 510, this is Kenya, cases per 1,000. Okay, these are outpatient visits. So it's a very high burden. The figure for Nairobi is about 2/3 of that, which would be surprising when you think about the urban slums and so on. But it's almost twice as high, Nairobi, compared to Kitui County. So Kitui is over 760. So there are factors at play which make certain counties more vulnerable in terms of COVID. So we've been focused very much on this national response. And I think it's something for the lawyers to look at how it went from, I mean, health is a devolved thing, and we can figure out how the national government started, but counties are sitting waiting for national to direct and give them materials. So they're sort of sitting back. And yet there needs to be a county by county response in terms of COVID over the next few months, because the national just will not do it. What will happen is that we will have certain counties getting hit harder than others, and then the whole crisis will be exacerbated in terms of how it goes. So just in conclusion, I think that we are focused so much on deaths, number one, when really we should be focused on the disease burden. We are focused a lot on the COVID itself and not on the effect COVID is going to have on vulnerable populations. In this case, vulnerable from the perspective of those who already have illnesses. And the illnesses are significant in our part of the world. The obvious one is the HIV burden. The less obvious one, but significant from the epidemiology coming from the West and China, is around diabetes and hypertension. We have significant populations. And for those two, a lot of it is urban. So we have to think, how do we react in terms of a response? It's not just COVID direct, but we have to recognize that COVID is going to expose the weaknesses of how we manage these chronic conditions. And I'll just put a little word here. A lot of these chronic conditions are not even covered by insurance. They tend to be the exclusions that are talked about. And so we're looking at a situation where it really doesn't matter what you say about how COVID is going to be financed, the burden is going to fall on households. And already, from the other speakers, we know that they're in lockdown, they're not making any money. Now add on the burden of having to manage their diseases being exposed by COVID. So I think we're looking at a situation where COVID is in itself is bad enough, but the fear of COVID is going to impoverish people and make them unhealthier moving forward. So in the medium term, we're in a bit of trouble. And then we have to remember that this virus, like any other virus that affects the respiratory system, thrives in cold and rain, and we're coming to the rainy season. So there's a question about how long are we going to go on with this thing? Our trend for respiratory illnesses peaks in May, June, July. So if the West and China have come out of winter, we're going into our winter now. So we probably, I don't know, probably need to think a little bit more about how we manage that over the next 3 months. So I'll end there, James.
Sorry, James, are you there? James, we can't hear you.
Thank you very much, Dr. Thank you. Thank you very much, Dr. for the session. And you've mentioned critical things, including the quality of data that needs to be looked into. And you also mentioned to us how pneumonia has been increasing over the last 3 years. But also we need to question about the effect of COVID on the vulnerable populations and how we going to take care of such populations. This is a very informative session, and I know the amount of time that we've given to our speakers is not adequate to deeply delve into the substantive issues around this. But I want to open the session to plenary, and I'll call Leila. Leila to talk to ask the speakers question. Please keep your comment or question very very short, so that we can be able to open up and have a number of other persons talking. And also we encourage our audience to please ask the questions in the chat box as provided, so that we can be able to direct those questions to the session speakers as the session goes on and within the timelines that we have. Leila.
Oh, thank you very much. So my question concerns what I feel is a neglected sector in government's response to COVID-19. Generally, it's the lack of mitigating loss of informal sector income. Now, I am aware that at the IGAD level, there is a fund that has been set up to fight coronavirus, and it's about $12 million. The AU is also establishing a 12.5 million continental anti-coronavirus Africa fund. UNCTAD and the World Bank are also doing the same. My concern is that COVID is a threat to national security. When the source of income is cut and people are not provided with alternatives, we cannot suppose that they will dwell in peace. And I think governments therefore must critically consider how to strike a balance in allocating money from these funds that are going to be received, so as to ensure adequate, accessible financial support for the informal sector. What I would like to hear from the panelists and of course our listeners as well is their view on the management of these funds and what type of approach can be adopted to ensure that part of these funds are directly transferred to those most in need, that is the informal sector. This is a question on how, and I do have a suggestion which I think the panelists can give me their comment on. The Muslim community in Kenya, for example, set up a Zakat fund a few years ago. Zakat is the Islamic tax on wealth. It is paid out annually, I think on a percentage of savings and assets that meet the threshold. The administrators of the Zakat fund in Kenya have a detailed list of people in need of financial support. Now, currently in response to the COVID-19 crisis, Muslims have pooled their zakat and are distributing it at various community levels in the form of food aid and cash handouts. Now, should such private sector funds, like the zakat fund, be the conduit to transmit finance out of the IGAD, AU, UNCTAD, World Bank funds to the informal sector? Should there be a partnership between the zakat fund and, for example, the World Bank fund? Now, questions may be flagged from the listeners, probably on the Zakat fund discriminating in favor of Muslims. I think such accusations will have no basis, because I was able to look at the register of beneficiaries held with the Zakat fund in Kenya, and I can confirm that both Muslims and non-Muslims who are recipients of the generous zakat and sadaqah provisions. Thank you. Back at you, moderator.
Thank you, Reira. Very much appreciated for that question, and I'll send it straight to the panel. But before we send it, let's have the second question. The second question from Mwaneki.
Hello, everybody. My name is Mwaneki with the Committee on Fiscal Studies. Picking up right where Dr. Aya has left off on the county's relation with the COVID-19 situation. I'm thinking about a situation where we have just come out of, or probably still in a situation where we had the locust invasion, and up to March 11th, we had 27 counties affected by the locust invasions. So when we talk about emergency funds, do we also mean that the counties should have very nuanced emergency funds to deal with the various levels of emergencies? Because the locust affected our food supply, and it will affect the future, and we also have the COVID-19 situation affecting the health. So it's a very dire situation, in my opinion. I think, also in relation to Dina's presentation, these emergency funds should also be gender responsive, in that the various actors in society, especially the women who are most affected in this situation, given the fact that children are at home and the elderly also do need support, and they are the ones who are involved in the daily management of the home, given a situation where the breadwinners are probably laid off or not being able to go to work. Gender responsive budgeting should also be taken into account when coming up with the emergency funds to cushion the population from a larger loss of economic strength, so to speak. Thank you.
Thank you very much, Mwaneki. Much appreciated. I want to throw these questions that have been asked by Leila and Mwaneki to the panelists, and I'll ask our panelists to just do justice 2 minutes so that we can take a number of questions around this. And let me start with Dr. D. Would you want to respond to these questions, and then we can move to Dina and Commissioner Mute in that order?
Thank you. I'll respond to the first one specifically. I think the answer to that question is that the monies that are being talked about are really a drop in the ocean. They couldn't probably provide a meaningful cushion to anybody. And I'll give you some numbers. We have 1.6 million registered or sort of small businesses, which employ 6 million people. We have about 6 million informal and registered businesses, which employ about 9 million people part-time or otherwise. So that's a total of 15 million people, which is 85% of Kenya's non-farm workforce. Now, the small formal businesses, which employ 6 million people, are really our economy. They pay 40% of the tax. So when we talk about our economy and people talk about corporates, a corporate economy employs only 2 million people. The small businesses which are registered and hair salons and shops and all sorts of things employ 6 million people, pay 40% of the tax. I did some calculations and published some articles on that. You can look at the numbers. If you take the hospitality sector alone, that is restaurants, and from tourism, which has completely shut down, and then you add restaurants and all sorts of whatever, and you combine both formal and informal, you are talking about 700,000 people. If you are to support those people for 1 month only with 10,000 shillings, it's $70 million. Okay. So all those monies plus World Bank, all the money we have gotten, couldn't support hospitality for 1 month, giving each household only $100. Now, if you do it for all the affected sectors in the economy, when I did a bit of my math, you are talking about at least $1 billion if it lasts for 3 months. You could probably use $1 billion to support about anything between 600 to 100,000 and 1 million people. Now, so obviously the scale you're talking about, you are not going to get international assistance on this scale. You can count that out. Which is why, if you look at my proposals, there's not enough money for a global systemic crisis in the world, in international development system. They cannot support the whole world at a go. They can support small parts of the world, but not the whole world. Now, which is why, if you look at some of the proposals, that's why I said, from an international sort of finance perspective, the most effective instrument would be a debt moratorium. Because if we get a moratorium on servicing our foreign debt, or official debt, that is equivalent to about $2 billion a year in our case. And since that's money we are going to use, that is money that is a scale that you can then have an intervention to provide a sort of economic and social protection sort of mechanism. But little monies from IGAD and all sorts of people, you can actually ignore them. The administrative cost will divert you from the emergency response. So if you're not going to have $1 billion, and that we have to do locally, the question is the government prepared to ramp up the deficit? The problem is that we're already running a deficit of 7% of GDP. Now, are you going to ramp that up? Or are you able to reallocate from existing? But we have to, even if we're not going to ramp up, which I don't think is a good idea, or you do a half and half, you need a sort of lifeline, as I'm calling it, of at least 1% of GDP to be able to deal with this. And the sooner we do it, the better. If we don't do it, this economy will be in meltdown in the next 2 to 3 months. That's for sure.
Thank you, Dr. Dina.
Yeah, thank you. And just starting from where Professor Andy has stopped, just to say that actually majority of people in the informal sector are women. And so therefore the need to actually also, when we are thinking about how we support people and small businesses and medium businesses, we also have to use a gender lens. And just to say that actually there are already existing tools that can be used that women's organizations have developed, such as gender responsive budgeting is an existing tool that is important in planning and budgeting and allocation of resources. So again, I think sometimes when we are in a crisis, we forget to tap into existing expertise and existing tools that have already been developed, and sometimes we think we have to reinvent the wheel, but actually we don't. So again, how do we use existing tools? How do we use existing expertise in the place? And again, I'll remind people that women's organizations are there as a resource, but also have developed these tools and can be used even during the crisis. And I just want to say that, okay, much as the resources that we are being committed aren't enough, but I think it is important even to ensure that those resources are used effectively and are actually reaching those that are facing multiple and intersecting forms of discrimination and exclusion, and really looking at those that are most in need of this support and also in need of recovery even beyond the crisis. And so, again, I do believe that civil society play an important role in terms of providing doing an oversight role and holding policymakers and governments accountable. And where is the role of civil society right now? Where is the role of women's rights organizations and movements? Where is the role of organizations led by disability, like disability organizations? Are they monitoring these resources to ensure that they're actually used effectively and they are going in the hands where they are supposed to be going? Because again, we are in this crisis where people are working from home, or they are not working at all, they are distracted, they are undergoing stress for different reasons, anxiety, and are they still being able to play this role? Civil society and women's organizations especially, do they have the capacity to continue working at home effectively and play their role of monitoring and holding leaders accountable? Is the parliament doing its role of oversight? I think those are questions that I want to leave with the audience.
Thank you very much, Dina. And I'll move to Commissioner Mute. And Commissioner Mute, while you are on it, please, I would like you to respond to this question from Frederick Ouko, who asks, what are the effective ways of educating the committee responsible for COVID-19 response in the region around issues of persons living with disabilities?
Thank you. So first of all, assuming that we can find the money, whether it's from debt relief or whatever other formula. Now, the assumption usually would be that government would have mechanisms which then would be used for purposes of, disbursing, this sort of money. And I think in recent times, we do have experiences of government, but I think usually disbursing money on a medium term rather than on an emergency basis. So when you think about, transfers, cash transfers, such as to, for older persons, when you think about cash transfers, as I mentioned earlier, around disabilities, persons with severe disabilities, or even the fund for persons with albinism. But I think clearly there's a lot of skepticism and justified skepticism in the country about whether our bureaucracy is configured to be able to transfer, to disburse that sort of money. First of all, where it is most needed, and again with the speed that would be required for these sorts of situations. I think that one of the things which which we are discussing, and I think there are discussions going on, for example, even amongst colleagues at the School of Law of the University of Nairobi and other places, is that clearly we should already, by now, have had a proper policy and legal framework for dealing with these sorts of pandemics. So then we are not putting in place law or putting in place structures at this point when there's already a pandemic. Because if we had in place these sorts of strategies, these sorts of legislative or policy instruments, what, for example, would happen ideally would be that we'd be thinking local. We'd be asking ourselves, how is it that we can get money, even if it's in respect of supporting, the informal sector, determined in terms of its use, in terms of need, at the local rather than at the central level. Of course, we have our devolved governments. I think what has been happening in the last few weeks sometimes has been quite troubling. I know of instances where the knee-jerk reaction has been to close markets in some of the counties. And I know, for example, I know of instances where you have crop in the field, people have come to buy carrots in the field, and suddenly they are told that the markets are closed, and they actually leave the carrots, on the farms. The shambas, usually because it's 1 acre. So you're asking yourself, what are these peasant, farmers going to do with this crop? So clearly, even as we speak about local solutions, I don't know that it would necessarily be county solutions, but clearly, I don't know that we can put in place those sorts of mechanisms on an emergency basis at this point in time. These are sort of things which you should have been preparing for, a while ago. Now, I think in terms of the question which Fred asks, clearly quite relevant. The question of, how do you educate, those people who are in charge of mechanisms, emergency mechanisms like these ones? so that they take better account of the needs of vulnerable groups or people, including people with disabilities. And of course, at one level, the whole discussion around inclusion, I think, has become hijacked, so that what at one level we'd be saying is, let's make sure that at the highest level of these initiatives, there is representation of the you cannot be able to have discussions about subjective realities if you do not hear the person who actually faces discrimination, the person actually who is vulnerable, in this case on account of disability. But the question then again is, which are these high-level institutions which are managing these emergencies? And is there room in those institutions for expansion so that actually you have people, not just people who sit around the table on a token basis, but actually who would speak and who would influence decisions? Because I'm not sure that the spirit of the Constitution has been respected in terms of what inclusion actually should be, even where people sit around the table, people with disabilities sit around, decision-making tables. And then again, at a practical level, I must say, in recent years, have excellent, usually young people working in a number of organizations which deal issues of disabilities, and actually who are excellent in the work which they do, and work which they do at the community level, at the grassroots level. So, when we're speaking about psychosocial disability, when we're speaking about other types of disabilities. So again, the question then becomes, how do you link these high institutions with these people who do this excellent work? So then actually they'll be able to tell you, these are the problem areas, this is where you need to go and learn. So yes, it's a difficult. I think for me, the question is, in this sort of emergency situation where you're thinking 1 month, 2 months, is anyone sitting to think and reflect, or are we just on the go, reacting to situations? That I think is our challenge.
Thank you, Commissioner. I would go straight to McKenna. McKenna, there is a question from Edwin Kemani, who asks, police brutality, as you mentioned, had increased, and you mentioned quite a number of countries. Does it show that there's disconnect between the state and their citizens, and who is not doing what in terms of disseminating information?
Okay, so when we look at the relationship between the police and the citizens and the state, you'll notice that once the state gives directions, we look at the police we look at police now implementing and enforcing whatever the government has said. But we can't really say it's the disconnect that is going on, because it's not only in Kenya that this is going on, because we've seen also cases of India where homeless people and people who are working and were in a state of lockdown were also happened to be in a position where there was police brutality. And when you look at it this way, you notice that the system itself does not support communication between the states and the citizens. However, when looking at the measures put in place so that the police can be able to, ensure that the citizens follow what the state has put in place, you notice that if in any situation, the police were able to get to the rules of engagement, follow the rules of engagement as they are, and also follow the humanitarian principles of, proportion types of situations where they are in proportion. Also, when you look at the rules of humanitarian law, you'll also notice that there is that disconnect, yes, but if they were to follow the rules in place for the humanitarian law and the principles of humanitarian law, where they are attacks are not indiscriminate, because you notice that most of the places with these attacks are places where the citizens or civilians cannot work at home. It's in areas where there are slums, areas where there are a lot of highly populated places. And so it's not really about the disconnect, but also about the police being accountable for their actions. And so if the police are made accountable for their actions, especially in cases of a pandemic, then we won't have to deal with cases of fiscal implications where citizens themselves are burdened, and they also have to now look for health costs of going to hospitals and whatnot, while they're also trying to make money to, eat day by day. And so when we look at it that way, we realize we don't have to really say it's a disconnect. It's more of putting the government accountable for the actions of the police, because they're the ones who are responsible for the actions of the police.
Thank you very much. McKenna, for that. And I'll go, Professor Atia. There is a question from Patrick, and he asks, what would be your recommendation on the oversight of the emergency fund, because there seems to be a perception that corruption prevails at the slightest opportunity. And now that we are going to use emergency funds, what are your recommendations on oversight around this? We can't hear you, Professor Atias. Professor, hello, can you hear me, Professor?
I can hear you. Can you hear me?
Yes, now I can hear you.
All right, I'm sorry. My electricity went off, so I guess it's messed up with the system. So I heard Patrick's question, and I think it's a very important question. So the first thing is that, of course, we don't have legislation that is clearly in place. But the second thing is we also don't know how much is in the budget in public spaces. So you said the figure out loud, but there isn't a public domain where we can find that figure listed out so far. So we need to immediately roll that out. Now, my potential solution, and of course feel free to rip it apart because it's thought in process, is I think it is very important to move from a whole government approach to now a whole country approach. And the reason I say that is because for the past couple of years, the current regime has been looking at a whole government approach, which sounds a little bit like a fairy tale to me, but it does have positives because it's going to bring together people from across different sectors to work together. Now, in this particular case of a pandemic, everybody is going to be affected by it. So it is crucial to bring in private sector, public sector, but very importantly, I've heard a lot of criticism about academia not being in those spaces. We actually are very active in the space. It's important to bring the thinkers into the room because the thinkers are still being left out. And as many of the other speakers have pointed out, making sure it is balanced, that the people of special needs are covered, people from the informal sector are covered. Now, it doesn't necessarily mean we have to have all of them in the room, but I think when we are trying to make the value for money go further, which is what we're going to need to have to do, I really think members of the informal sector and trade unions have to be in part of the oversight. I'm less convinced that trade unions and informal sector should bring in their leaders. I think that very often some of them have lost sight of the value of money issue. We need to also bring people in from the middle and the lower levels, where I calculated yesterday, and excuse me that I did it only yesterday, a meal of sukuma wiki and ugali costs you like 20 to 30 shillings if you do it yourself. Now, if we are going to move into bare minimum society for survival purposes, we need to already have oversight that is from all levels, but it must avoid wealthy people because wealthy people don't always understand how much money can be pushed further. So we have to really reflect on who is in that. So that would be on the people that I would want in that system. How they roll it out is very important as well. I think that transparency is crucial at this point in time. We need to make sure this information is up online, publicly available on people's phones and apps to see how much we need and how much has been spent, and therefore how much is left over. And there is an idea that I shared with on a paper that I've sent for publication. I hope it will get published. I think we can adopt a family. I think we are making certain mistakes in the spreading of food. I know people have talked about food being delivered into slum areas, but we have a problem. Who is delivering the food? And if it is these well-wishers, were they properly covered? Now, these are crucial issues. So it means that we do have to come together and do it together. And passing over of cash at this point in time may be actually a better solution than buying food packages from supermarkets who are still going to make a profit. It may be better for people to buy things quickly from the rural into the urban. I know we had a stopping of milk coming in big jerry cans into the cities. I think all of these need to be opened up. So I see two types of solutions coming in emergency fund again. I see the financial responses, but I also see the goods and services line and ensuring that the value chain doesn't get broken down. So those are my initial thoughts on how I think it can work, and I'm very happy to add more.
Thank you. Thank you very much. Thank you very much for that, Professor Atias. And I want to ask Dr. Richard, Sala Mukasa asks you to comment on the chloroquine that has been tested on COVID patients and its promising results. What would be your views on that? And of course, you've mentioned you've done a lot of work, especially in the informal sector. We'd like to hear what risk, when it is over-the-counter purchase, does that expose the population into?
Okay, so one is a procedure that's not really my area. I think when we're looking across the world at various treatments and trials that are being conducted, we have to recognize that a lot of these are being done very quickly and being done on very sick patients. And then we have to come back and remember what our situation is in this country. And that is, when we think about the burden and the way our health system is, we really don't have the capacity to take care of very ill patients. And so if we're focused on the 5% who are going to have very severe COVID, we may be in a situation where we put in a lot of resources for very little, and our outcomes tend to be quite poor. So for me, the way in which we should be analyzing, this is from a public health perspective, not an individual perspective, is that we should be looking at treatments that are cost effective. So it is one step to have to be told that, oh, this works. But then we need to then identify in our local context, who will it serve? And I think that's not clear right now.
Okay. Thank you. Thank you very much. And I would move to Dina. And there's someone who asks, Ivan asks, do you think the lockdown will make patriarchal institutions start appreciating the value of productive labor? Dina?
I hope so. I hope so in a way that I'm hoping that this epidemic is going to help us reflect and recognize that actually things that we thought were impossible can be possible, and things that we thought aren't effective actually can be effective. Of course, there is on one hand the fear that already the measures being put in place are kind of normalizing, the example, restricting movements, and we also know that actually women are obeying the restriction of movement and staying at home more than men are doing that. Men are still leaving the houses more than women are doing, without knowing where they are going. They are not necessarily going to the grocery shops. And so there is that part of normalizing the patriarchal norms of restricting women's movements and those kind of things. And we hope that this doesn't actually get to be normalized going forward, but actually that it will look at the positive side of things and be reminded that actually there are things that we can do for, we don't have to pay for. I hope that we can remember that unpaid care work is extremely crucial and important. So, for example, when you say homeschool the children, who is going to homeschool them? It's people that are using that time, and that labor needs to be valued and recognized and rewarded. But also, I think we saw an example of in Spain, where they announced nationalization of public health services. So meaning even private hospitals have to give public health services and care without making people pay in this pandemic. This is something that we have been pushing for in terms of ensuring that actually public health is a public good, but we know that in African countries that is not the case. But can we learn from this pandemic that actually public health needs to be a public good? It needs to be accessed by everyone, not only by those who can afford it. I think, in Kenya right now, private sector is actually also capitalizing on the situation and forming a parallel channel of testing and charging people, I think, 13,000 Kenya shillings, which is about $130, which is a lot of money. Who is going to afford that? So if we have been saying that private sector can actually support in development, where is the private sector at this time when we need them most? Is it supposed to be creating parallel channels and charging citizens for these services? Or is it supposed to be at this time actually contributing and supporting in ensuring that citizens do get access to services that they badly need right now?
Thank you very much. I would want to learn two questions through Dr. D. One question comes from Evelyn Mwendo, who asks, if the situation as it is requires total shutdown in Kenya, would a wage supplementation program based on data from KRA help maintain people's welfare? And a second question from a guest who asks, you mentioned a great point on moratorium on debt servicing. Do you opine with the unlovering of our economy and focus on infrastructure development in Kenya and Africa that shall change?
Let me start with the second. Let me start with the second question. I think it should change, and I have said as much. I have an interview which is uploaded on the Elephant website, which I did last week, and it's a fairly long one, but I do address towards the end that question of infrastructure-led growth, and that this COVID crisis, which will lead to reevaluation of what we really mean by development. And I think that's one of the questions that one of the issues that we will revisit. I think it is now very alive to people that development is really about human security, not about growth and all the other things that we are preoccupied with. Now, on the question of wage supplement, let me make clear, there's a lot of people asking what government should do and that kind of thing. And we seem to have lost sight of the question that resources are scarce, which is why economists exist, to allocate scarce resources. So how much we are able to do is going to depend on how much we can finance, not how much need there is. Yeah, because the resources are competing, and our resources are falling. Public resources are falling very dramatically. My guesstimate is that for the rest of the year, government revenue will fall. We'll have another shortfall of about 150 billion shillings. So revenue is falling through the floor because you start shutting down the economy. So there is a whole macroeconomic sort of risk management thing you need to do. So what we need to be thinking about is trying to put a floor below which the economy will not fall. It's really a safety net for the economy. Because if it collapses, then everything else is moot. Even your pandemic response is moot. Yeah. So the question is, which is why if you go back, I mean, they made a proposal of something I called what we need is a lifeline fund. I distinguish two things. A lifeline fund to keep as many businesses as we can afloat. Many are going to shut down. And that's one thing. And it's different. It's not a welfare intervention. It's not a safety net. It's an economic intervention. It's a macroeconomic risk management intervention. But it so happens that requires that you support people, you protect jobs so that you give those people who've been laid off money to eat. Now, there's also a dichotomy that we are saying that we should support small businesses. Now, that dichotomy between big and small is actually a false one and a wrong one, because even big businesses employ people who are on low incomes. In fact, the big majority of them are on low incomes. Let me give you an example. The export horticulture industry has shut down. So all those flower pickers in Naivasha are out of work. They don't work for small businesses. They work for a very big industry, but they are vulnerable low-income workers. Okay, so this sort of dichotomies we are making. There's no difference between a flower picker in terms of their vulnerability and the way they live, and the person who works in Juakali down the road, or in fact the small business who they buy from are probably better off than the workers themselves. So the point I'm making is you start with a macro financial assessment. How much can we afford without the country going belly up? And I have said at most at this point in time, we're talking about prudently no more than 1% of GDP is what we could make available. I think something that's about 100 billion shillings. Hit by estimate. $1 billion. Then you begin to ask, who should it go to? And then you say obviously, then you start targeting. Welfare targeting is a very problematic thing in social and economic and social policy. So you ask, who should you target? Obviously, you should target the businesses and the people who work in the businesses which are most vulnerable and which have shut down. So, for example, we do know horticulture has shut down. So, if we had this fund up and running, those businesses should be able to go to their banks, say that I have 200 workers. If we have fixed the amount, we said, look, this money can support the businesses we think which are vulnerable, the people who are vulnerable, maybe up to maybe 10,000 shillings a month per worker. So, this business should be able to go and say, I have 100 workers. And then they negotiate with their bank, because banks already, we have a system where banks disburse public loan funds, women's fund, youth fund. So there's a template already exists. Okay. So they should be able to go and say, as this flower farm, it has 200 workers, they're out of work. We are only able to pay them up to end of April, perhaps. After that, they are redundant. They say, no, don't declare them redundant. You can borrow 10,000 shillings per worker per month up to 6 months. And then the business is the one which borrows. But each of the workers actually signs off a check of loan themselves, or it's shared between the business and the worker. And there's a long grace period, and we say this money will be repayable maybe after a year or something like that. So you start with what can you finance? And then you think about targeting, and then you think about delivery. But there's a sense in which when I listen to the public, they're saying, oh, everybody is affected. There is no way. The amount, and I think I put these figures out a couple of days ago, our tax revenue per person per month in Kenya is 3,000 shillings. Okay, all the money the government has, 1.5 trillion shillings in tax, works out to 3,000 shillings per person per month. After debt, interest on debt and salaries is 40% of that. Okay, so the government, after paying interest and debt out of 3,000 shillings per person per month, it is now left with something like 1,600 shillings per person per month. So when you start saying that the government can disburse 3,000 shillings per person for the duration of this crisis, those numbers are way out of. It couldn't do 300 shillings, forget 3,000 shillings. So I think it's also important to educate people to get a sense of perspective of what our public resources actually look like. And I think this is a sort of thing which is making some people, I don't want to go there to say that we should print 1 trillion shillings or something like that. It's just not viable. So let me emphasize, resources are scarce. They were scarce even before COVID crisis. We couldn't fund a welfare system before. We are not going to be able to fund one now. We're going to look at how much money we can finance sustainably, we can sustain, and then ask questions of where do you get the most bang for buck in terms of both economic risk management as well as welfare sort of considerations.
Thank you very much, Dr. D, for taking us through that final lap of question. I want to mention Commissioner Mutet at the beginning of the session took us through the process and the requirement for psychosocial support. That is mediated blanket lockdown where the voice of people living with disabilities have not been heard. The question around social distancing and what it means, for example, to a blind person and for people living with disabilities who require caregivers, what exactly does that mean for them? And also, the question around learners with disabilities and whether generally as a country we are communicating adequately to address people living with disabilities, and what about access to information during this time? Professor Atias mentioned, took us through financial understanding of Africa people during COVID-19 with clear metrics around fiscal legitimacy. And also we had Dina take us through the question around, current economic model and how, how it has failed, and the increasing levels of inequality, which are very high, and looking around the socio-economic issues around the food supplies, and urging our policymakers to think about emergency services and the question around gender during these times of COVID-19 pandemic. McKenna took us through humanitarian law perspective on police brutality across Africa and the increasing tension between state and citizen. And Dr. Richard took us, asked a very pertinent question around the quality of data that we have and the increasing disease burden and the effect of COVID-19 on vulnerable people. And of course, he extensively quoted about the study in Kibera and, about people don't know, for example, about the disease and how COVID-19 will expose much more about other underlying disease conditions. Dr. D, on his part, mentioned how we have to accept the situation because we don't know whether this is going to be short-term or long-term, and that markets will not work. And the economy depends on social interaction and mobility. And he mentioned how the state, how to stop the pandemic. It had meant that global aviation has stopped, meaning tourism business has come to literally a halt on itself. And on his last comments, he winded up on giving us an example on the horticulture industry where we've had to lay off all those workers. And he's mentioned about the lifeline and how that lifeline fund could work, and including reallocation. And he scored around us thinking about 1% of our GDP, which is roughly around 100 billion Kenya shillings, to be used for support around that. I want to thank everyone and our speakers very much for having joined us for this amazing and informative session. it's been, it's been deep. It's been such a great learning session for this. And I want to remind all our listeners that this webinar will be running every Thursday from 10 a.m. to 12 p.m. for the next 5 weeks. And it's being run by Fiscal Law Africa. The Twitter handle is Fiscal Law Africa, and you can get much more details around that. I want to appreciate all the speakers, all the listeners. Thank you very much for coming for this session. And this on the platforms at Twitter platform at Fiscal Law Africa. This particular conversation will be uploaded for reference. Thank you very much, and I want to call off this session for now. Asanteni sana.
Thank you, everybody. Bye-bye.
See you.
Thank you.